Good morning all. Today we are going to revisit lead groups. That means the different group of leads that look at the heart from different views. So we can diagnose the diseases, especially myocardial infarction of the different wall segments as per the lead groups. And I am going to show you the lead groups directly on the ECG paper. So kindly Mr. Negi, please show a close-up of the ECG paper so that we can see all the 12 leads here. No, we should be able to see all the 12 leads. Okay. Now, last time we discussed inferior lead groups. So, inferior lead groups are 2, 3 and AVF. These are the inferior lead groups. So, if inferior myocardial infarction is present, this will be picked up in 2, 3 AVF by STT changes. So, how these leads look into the inferior wall? You know, lead 2 is minus and plus. So, it will be looking at the heart from the inferior side and looking at the inferior surface of the heart. So, it is looking like this from 60-degree angle. Lead 3 is minus and plus. And when we pull it like this, so it will be looking at the heart again from the inferior side, but little from the right side, inferior and right, and looking at the inferior wall of the heart from plus 120 degree. And when we talk about augmented leads, so AVF is directly on the 90 degree because augmented lead is unipolar. So one you have on the right arm, that is AVR, one you have on the left arm, that is AVL. So because positive electrodes are there, so they are looking like this. And AVF is in the foot, so it is looking, positive pole is there, so it is looking like this, exactly at the 90 degree. So 2, 3 AVF are inferior lead groups. Now look at the other limb leads, 1 and AVL. 1 and AVL. So 1 and AVL, 1 is minus and plus, because right arm will have everything minus. So minus and plus. So 1 is looking from this side to the heart. So it is looking from the left side. Okay. And AVL is sitting on the top of the shoulder. So this is also looking from the left side of the heart. So these are left-sided leads, 1 and AVL. So 1 and AVL actually represent high lateral wall of the ventricle, left ventricle. So they are high lateral leads. Alright. Then we come to what is remaining is AVR. AVR is one limb blade which actually looks only into the cavity of the heart and maybe some part of the right ventricle directly. But since all the complexes are negative in it, so it's not very interpretative in the sense of picking up a myocardial infarction. It has got some indirect changes in it that we'll discuss when we discuss acute coronary syndrome and ECG changes later on. So we are done with 2, 3 AVF, we are done with AVR, and we are done with 1 and AVL. Alright, now we come to chest leads. So chest lead I will show on the board. Now V1 is looking into part of the right ventricle and interventricular septum, because V1 is situated little on the right side, because we keep it on the right side in fourth intercostal space. So actually right ventricle is anterior ventricle and interventricular septum is just behind the sternum, and V1 is close to the sternum. V1 is also close to the sternum, V2 is also close to the sternum. So V1 is and V2, these are actually septal leads. So V1 and V2, they represent septal myocardial infarction. Now V3 and V4, these are anterior leads. You can see they are lying on the anterior wall of the left ventricle. And V5 and V6 are again, see V5, V6 go behind like this. So they are looking from the left side towards the heart. So they again represent lateral leads, right? So they represent lateral MI. So if a patient has changes in V1, V2, we will say septal MI. If patient has changes in V3, V4 only, we will say anterior MI. If changes are there only in V5, V6, we will say lateral myocardial infarction. If patient has changes in V1, V2, V3, V4, so it is septal plus anterior, so anteroseptal myocardial infarction. If patient has changes in V3, V4, V5, V6, so this is anterior and lateral, so this is anterolateral myocardial infarction. And if patient has changes right from V1 to V6, this is an extensive anterior or anterolateral myocardial infarction. So if I have to group leads, again 2, 3 AVF represent inferior leads, 1 AVL, V5, V6 represent lateral leads or lateral myocardial infarction, V1, V2 represent septal leads, V3, V4 represent anterior leads. So, and high lateral will be 1 and AVL. 1 and AVL will be high lateral leads. So if I mean this is how you are going to interpret. I think this is enough for today. Am I missing something today? No. So this is all for today. Yeah, just one thing. None of the lead is looking directly into the posterior wall. So none of the lead is looking directly into the posterior wall, and right ventricular infarction changes may be picked up by V1 and to a certain extent by V2, but again for them we have to modify the leads and put the leads on the right side of the chest. Especially we take V3 and V4 leads from the left side and put it correspondingly on the right side of the chest to pick up the right ventricular infarction. Similarly, for posterior myocardial infarction, we pick up the V5, V6 and put them behind near the scapula, and so that posterior infarction can be picked up. But indirectly, posterior infarction is also picked up by V1 and V2 leads by indirect changes. So that's all for today, guys. Thank you so much for watching this video, and if there are any comments or there is any clarification you want, you can put in the comment section box. And thank you. Jai Hind, Jai Bharat. Dhanyavad.